Hello, everyone, and welcome to another evening of Fresh, Natural, and Live. We're going to come to you tonight with a very special topic. We're going to talk about dementia, and this is a topic that hits close to home because I'm going to give a case presentation of a patient I'm taking care of with dementia, and we're going to discuss dementia from a different perspective. Now, typically, when if I were to cover a topic like this, or typically when I cover a topic like this, because I've had this topic discussed at different conferences that I've hosted and the like, I would bring a neurologist on. And tonight we do not have a neurologist. And I did that on purpose because I want to talk about dementia from a more global perspective. I'm going to give you a few basic aspects of dementia, the different causes and the types and some of the mechanisms. But what I want us to do is I want us to have a discussion on dementia from a more global approach. And I'm going to talk about a patient, as I said, that's very close to me. That patient happens to be my dad. But I'm also going to talk about dementia from the standpoint of my late mother, who passed away in 2002. And some of the things that I learned, from her condition, as well as what I'm learning from my dad's condition. And so we want to give you some interesting insight from our thought process from a natural approach, from a natural health and disease pathophysiology. So without further ado, I'm going to bring my co-stars here with us today is Sosa E. She's our in-house nutritionist, and she's going to be helping us deal with some of the nutritional aspects of this issue. And Dr. Celeste Palmer, our pediatrician. And you may ask, what does the pediatrician know about dementia? We think about dementia in older people, but the average age of onset of dementia in an article I read a number of years ago is 45. But there is a pediatric aspect to this, and we're going to bring that in as well. And y'all getting feedback? It sounds good on my end, but it's intermittent feedback. Does that sound okay? Okay. All right, can y'all hear me okay?
Yes.
Okay, good. Everybody went frozen. So anyway, without further ado, so the patient I want to discuss is an 87-year-old man who has a history of high blood pressure. He's a chronic smoker. He's been smoking since about the age of 17. And he has a history of ulcer. He worked as a truck driver for about 30 years. He missed about 5, I think maybe 7 total days of sickness in that 30-year period of time. And 5 of those days was when he was in the hospital with an ulcer, had a GI bleed. He was taking a lot of aspirin. So no long periods of time of illness. I think he had a hospitalization in 1977 due to that ulcer that I mentioned. After he had retired, he had an episode of diverticulitis, and this was in 1998, 99. And he had diverticulitis and had to undergo surgery for an abscess that formed. It was successfully resected. But after that time, he had no other hospitalization. So really a long history of no hospitalizations. Took 2 medications for blood pressure. One was Norvasc and hydrochlorothiazide. So he wasn't on a lot of medications, et cetera. So on the surface, you look at him and says, well, had a relatively healthy life, but did have hypertension, was on medication for that. Didn't see the doctor a lot, typical man. But he did smoke. Now, he smoked, as I said, since the age of 17. He quit smoking 2 years ago. So from 18, so almost 70 years of smoking. And I estimate he smoked about a pack to a pack and a half of cigarettes per day. So chronic smoking, hypertension, 2 medications, no known diabetes, no known kidney disease, et cetera. Had surgery at the I guess age of late 60s, early 70s, and also had an ulcer in 1977. So relatively healthy as it goes with the typical American who's probably on about 4 or 5 medications at that time and so on. Now, In the recent years, I would say most notably from, say, 2008, 2010, I would say definitely 2011. Let's say 2011, we started noticing significant decline. Not say significant decline, maybe some slight memory loss and things like that. Around 2014 and 15 became more noticeable. Again, he was still, going to the bank, going to the store, doing all of his normal activities around that time. So from 2011, 2014, doing a lot on his own. 2015 and 16, doing a little bit less. My older sister, who stays with him, started helping him out more. Now I say doing less. So I'm going to give you a description. So from 2011, 2014, paying his own bills, going to the store, driving his truck, visiting friends from time to time, relatives. 2014 through 15 and 16, still doing some of those things, but relying more on my sister to do more. He's paying the bills more and doing things. Now, we don't really notice that as a decline. I'm looking in hindsight and with a little bit of a 2020 vision. But it's quite subtle in terms of her doing more for him now. And I'm going to get into that a little bit later in our discussion. Fast forward to 2016, 17, and 18, we noticed more significant decline. I believe it was in 2017, he got in his truck and drove it through the back of the garage, through the fence. We had a wrought iron fence between his house and the neighbor's house. Drove it through the fence into the neighbor's driveway. And so, you had this big gash in the garage. And so it was quite an ordeal. And I remember him calling me, and he just says, quite calmly, I ran into the garage. I said, oh, really? Now I'm thinking that, he backed up and maybe bumped the mirror or, caught the edge of the garage door backing out. And he was fairly calm about it. So that's what I thought was going on. But then my brother called me later. My brother gets very excited. And my brother called me, he ran through the garage. He ran through the garage. And when I looked into it, it was like the entire back of the garage was, smashed open, and the fence was caved down, was run over. And but interestingly enough, he drove the truck back and parked it back in the garage after. So I think he was just mistaken the accelerator for the brake. So that was a really, salient, point around 20, I think that happened in 2017, if I remember correctly. And then more of the decline happened. So prior to that time, we had signed his will, got his durable power of attorney, and things all lined up. But we really had not acted on it. It was, there filed away. 2018, 2019, we started to notice more progressive decline. His walking got worse. And he started losing the ability to carry out activities of daily living. In 2019, we started getting to where he's having to wear pull-ups and the like, but he's still able to do things for himself around the house. My sister works full time. She goes away. He's able to go and warm up food. He cleans up in the kitchen and so on. So he's still doing some of those basic things up until the middle and latter part of 2019. He becomes less mobile, less able to carry out these activities of daily living. And then going into 2020, we're having to get a sitter for him. And so now we're like the middle latter part of 2020. For the last month, we've had to have a full-time sitter with him. So his cognition has declined rapidly in 2020 to where he has an inability to express his feelings. You get a sense that he understands things, but his expression of his knowledge, and I'm going to talk about that a little bit in a few minutes, became very prominent, problematic rather. And so it's hard to understand what he wants. But if you say something to him, you get a sense that he understands what you're saying, but he can't really, reply in a way that you know that he understands. So he has a difficulty expressing himself. To now, he's gotten to the point where now he had some arthritis. He's been chronically bow-legged. And so he had a severe pain in his left knee. And it got to the point where he wasn't able to walk. I had to go over with a orthopedic surgery colleague of mine. We gave him knee injections and we put lidoderm patches on him, got him physical therapy, got him back on his feet. So he's back up walking on his own now. And he moves around the house quite well, which is great. He now also goes to the bathroom on his own. Most of the time we had gotten to where we were changing him. And he got from, having to be changed to now he's back using the bathroom on his own most of the time. So he's not having to be changed, by the sitters very much. My sister, she kind of, she fussed at him a little bit. She said, look, if you don't want those women, changing, you better get up and use the bathroom. And so he's he's doing that thing. So we have this situation. And so I just want to give you that clinical picture. There was a rapid decline in the last 6 months. He reached sort of a nadir, but then there was an increase. Now, notice I haven't talked about what we've done, what we're doing, because I want to save that for later. So that's the clinical picture. That's what we're dealing with my dad, 87 years old, chronic smoker. He also has congestive heart failure. So that was diagnosed when he was in the hospital a number of years ago. And so, that's something that we're managing as well. And I'll discuss that with you. So that's the clinical story I want to share with you. And of those of you who are checking in, throughout the show, we'll talk about some of these bits and pieces as we go. So what I want to do is talk about dementia in general. I don't want this to be an academic discussion, but I will give a few overview points just for the sake of perspective, because we did have one person send a question in who asked the question, which is a great question: how do you prevent dementia? We're going to talk about that. But I want to talk about what the general etiologies or cause of dementia are as it's discussed in the medical literature without getting too detailed and too technical. Now, when you think of dementia, and dementia is sort of really a decline in brain function, and it presents clinically as cognitive impairment. So one day you're forgetting, where your keys are, and then it progresses to where, you don't remember, where you put your underwear and so on and so forth. So it can go in different ways. Patients with dementia can cover it up because they know there's this one thing interesting. I'm going to deal with many patients with dementia. They have a sense of their decline. So there's an awareness on that part. And they try to cover it up. And so that's actually kind of the most difficult part to deal with, because while on one hand there's a loss of cognition, on the other hand, there is an awareness of that loss of cognition. So it's kind of a weird juxtaposition of, you're kind of losing it on one hand and you're aware of your loss and losing it on the other hand. And you try to cover it up in some cases. So we deal with that. Now, so what are the main causes of dementia? Most people are aware of the term Alzheimer's disease. Alzheimer's disease is considered the most common cause of dementia. Alzheimer's disease is generally a cognitive decline when there's really not a clear-cut definitive cause. Now, typically a way to definitively diagnose Alzheimer's disease is doing autopsy, which, of course, many people with dementia don't get autopsies. But in autopsy, you can see neurofibrillatory tangles, microscopic exam, and you can also see amyloid deposits in some cases or the like. There's some MRI findings of Alzheimer's that could suggest Alzheimer's disease as well. Vascular dementia is another major cause of dementia. And vascular dementia could be people who've had strokes. So if you know someone who's had what we call an embolic stroke, or stroke due to a blood clot, or they can have a stroke due to bleeding or hemorrhagic stroke. So strokes are a major cause. And typically what you have is somebody who has blood vessel disease in the brain, who may not have had stroke, but they have progressive loss of blood flow to the brain, and therefore they have progressive deterioration in brain function. So, you get someone over time the brain function starts to slowly decline and deteriorate, and it's because they're developing more and more vascular disease, and they could be associated with loss of nerve function. Now, there could be other things that are contributing to this, and we'll talk about those other things as well. Now, there are other causes of dementia where you can have normal pressure hydrocephalus and other types of Lewy body infiltration. Amyloid deposits can be seen, which is thought to be part of Alzheimer's and dementia. So there are all of these other kind of, clinical syndromes that we contribute to dementia. But the two big ones are vascular and Alzheimer's. And most of the time, people have vascular dementia or vascular abnormalities in the brain, and they all have a clinical diagnosis of Alzheimer's. Those two juxtapose, because you're not sure if the blood vessel disease is enough to explain the amount of dementia, so you give them an Alzheimer's diagnosis as well. So vascular dementia and Alzheimer's are pretty much what we're dealing with. Vascular dementia may be the overriding one, even though Alzheimer's dementia is statistically considered the number one cause, with vascular being number two. So I want to give that overview and let that be the foundation of our discussion, but we'll dive deeply into that, because there's some metabolic things that can contribute to brain dysfunction that I want to discuss as well. So let me bring my colleagues in on this discussion. But let's deal with Dad. So he's 87 years old. He smoked for almost 70 years, high blood pressure, and clearly has cognitive decline. He doesn't go see doctors, so we haven't done an MRI. We haven't diagnosed him with a stroke. I doubt we'll be able to do that, certainly not at this time. So I would say with those risk factors, he's a good candidate for having vascular dementia, even though we've never had a clinical stroke.
How long was he on hydrochlorothiazide?
Now, that's a great question. That medication has been off and on some. Now, he's no longer on hydrochlorothiazide or anything else. So I discontinued the hydrochlorothiazide probably 2 years ago. Now, he was on it maybe for a decade prior to that. Right? I'm guessing, but I would say, let's give it a range of 5 to 10 years to be safe, but an extensive period of time.
Okay. Yeah, I asked that question because hydrochlorothiazide depletes magnesium, CoQ10, zinc, I think some potassium, but the CoQ10 is really key for brain health and also for cardiovascular health. And so over time, a lot of times if we're taking medications and no one has really checked what the nutrient depletions are, we can get deficient in these things, which then continues the spiral down towards something else, which is why it almost is like, you're taking the medication to solve a problem, but then it almost creates another problem, which is why I always have to check medical, nutrient reaction, depletion of medication.
Well, I'm glad you mentioned that, Asosa, and I want to dig deeper into that. But what I want to do is throw out a point to underscore what you said, because it's extremely important. Because, if we look at the data, and Dr. Michael Greger has lectures on this, and the data is, I think, fairly clear. The number one cause of morbidity to mortality is heart disease. Number 2 is cancer. Number 3 is medical treatment. Now, if you separate medical treatment to pharmaceutical therapies, and I think the prescription drugs are probably number 4. But cardiovascular disease being number 1, stroke. Then you got things like diabetes, accidents, so on and so forth. But medical treatment / medications are either 3 or 4. And the reason I underscore that is because of what Asosa said, in the sense that, hey, how long was he on the hydrochlorothiazide? Because she immediately jumped into, now we look at hydrochlorothiazide PDF and we look at side effects, and it talks about low potassium, low magnesium, and other side effects, dehydration and dizziness and headache, etc. But the depletion of other substances is really important. And there are a lot of drugs that will deplete CoQ10, acetaminophen, over-the-counter Tylenol, and various other over-the-counter, which I did not get into the details of the over-the-counter medication that he took because I wasn't aware of what he took over-the-counter. But there are many over-the-counter medications that also deplete coenzyme Q10 and other nutrients, not to mention gut flora, okay, which again has its own set of issues, some that we know about and some that we don't know about. But coenzyme Q10, you want to talk to us about that, Sosa, coenzyme Q10, and kind of share with the audience some of those issues with coenzyme Q10, what it does and how it affects us?
I mean, I can't really go super deep. It's just essential for brain function. It's essential for mitochondrial function.
Mm-hmm.
And then I'm not really. I know that it's connected to heart as well, but I don't know why.
Yeah, it's an ubiquinone, and like you said, it affects mitochondrial function. And mitochondria is responsible for ATP production. And so basically in the mitochondria, you have, from a biochemical standpoint, there's if we all, and I'm just going to break it down from the fundamentals, we all take a deep breath, to bring in oxygen. And that's important because that oxygen goes into our cells and is coupled to the production of ATP. So with every breath, it gives us some amount of ATP. So a certain amount of oxygen goes in and buys a certain amount of ATP. So let's say 1 unit of oxygen gives you 2 units of ATP. But if the mitochondria is not functioning normally or not healthy, that's what's called an uncoupling of that, meaning that you may need, in normal setting, you get 1 unit of oxygen, get 2 units of ATP. But if it's uncoupled, you might need 4 units of oxygen to get 2 units of ATP. So you have to breathe twice as much. So at the biochemical level, if a mitochondria is not functioning normally, that's kind of an oxidation, ATP, phosphorylation uncoupling, or you require more oxygen to make more energy. So that's only one thing. But as you mentioned, it is affecting, associated with heart function. Low magnesium, low coenzyme Q10. Magnesium is an intracellular ion. It affects, virtually all the cells. So, skeletal muscle function, cardiac muscle function, and neurological function for both of those. So, we can probably talk all day long on just coenzyme Q10 and magnesium deficiency and say, hey, this is, what's going on.
Those are very common deficiencies. Those are very common deficiencies. A lot of people don't even have a multivitamin that has coenzyme Q10 in it.
Yep. And ones that do have a multivitamin, coenzyme Q10 in it, has a lousy multivitamin. They may not be absorbing it. And so, but it's one of those things. Now here's a question, and I want the audience to get in here. Again, this is meant to be a discussion. And we're going to talk about kids in a minute, so you're not going to be let off the hook here. But Nicole asked about Prozac and fluoxetine. Will that deplete any vital nutrients? I can't say specifically if they can. I'll have to look that up. Does somebody want to do a Google search while I'm so that's want to just do a Google search?
I could know that off the top of my head, but I don't.
I'm gonna have Celeste do a Google search, and then I'm gonna go on.
One thing I will say about a lot of drugs for depression that I was disturbed by is that a lot of them do deplete nutrients that are actually important to not be depressed.
Yes, and the thing is that that's a great point. What I will say is any drug that acts as a antidepressant was acting neurologically can have a neurological effect. So it can cause depression or cognitive decline. So Nicole, while we're looking up these potential nutrient deficiencies, what I will say is that Prozac fluoxetine has neurological effects, and part of the adverse effect could be neurological decline. So let me go on. So the important point is on hydrochlorothiazide and magnesium and coenzyme Q10 depletion are important issues. Now, one thing I'm going to point out that I left out in my clinical discussion, which I think is an important piece to interject, is that 2 years ago, October 2018, I remember, my sister called me to the house, and my dad was, he had his baseline cognitive decline, but he became acutely delirious and poorly responsive, et cetera. I saw him, we had a fever. And so we got him and we took him to the hospital, admitted him to the hospital, put him on my service. And he was kicking and screaming, didn't want to go. But we went ahead and got him anyway. So, Nicole, sorry, I can Google too. Just curious if you guys had any personal insight.
Yeah, I was remembering B vitamins, but it does do CoQ10, magnesium, sometimes melatonin. So sometimes people have sleep issues. And then B vitamins, some of the B vitamins. And the reason why I said what I said earlier is because also B vitamins and stuff and magnesium is very, it's very common if someone has anxiety or depression, they might be low in those. So all of those are really important to actually keep your mood up.
They also advise taking folic acid as a supplement.
Yeah, that's B. Yeah.
Okay.
B vitamin too. Yeah.
Yeah. Okay. So great points. B vitamins are also nutrients that can be depleted by these agents. Let me put it to you, the audience in a general format. Really, you want to look at nutrition not as finite consumption of nutrients. Say, okay, I'm taking this, that, and the other. First of all, you want to look at the consumption of food and the consumption of food and the adequate digestion of food. Now, I did allude to the fact that many types of medication can affect the microbiome, and that's really important because adequate nutrient absorption is an important thing. So let's say, for instance, you're eating all these wonderful foods and you're taking a lot of these supplements, but you're also taking substances in that are causing an adverse effect on your microbiome. So you don't have the adequate number of bacteria in your gut, intestine. You're not going to absorb this. And in my clinic, we do a lot of micronutrient testing. And we see a lot of patients who are eating a natural, healthy, plant-based diet, who are also taking supplements, some over the counter, which may not be the high quality, but some of them are taking quality supplements. And despite that, we're seeing significant amounts of micronutrient deficiencies, across the board. And then when we look at the microbiome, they're very deficient in the microbiome. They have a malabsorption syndrome. And so you can have a malabsorption syndrome related to, let's say, for instance, you went, to the dentist and you had antibiotics. That can wipe out your gut flora, and it may require a long period of time to replete it. We will bring a GI specialist. We're going to talk about microbiome on one of these sessions. I'm actually planning that talk in the not too distant future. So microbiome is very important from nutritional supplement, food breakdown, and nutrient absorption. So these are the types of things we need to think of. So it's one thing to be consuming certain nutrients, but the other thing is that you need to make sure your gut flora, your whole microbiome is organized and healthy and functional. But anyway, one of the things in the clinical scenario, he had a bacterial infection. We rushed him to the hospital, and he got intravenous antibiotics, which again comes back to the microbiome issue. So then absorbing nutrients. At that time, and this was 2 years ago, that was when he stopped smoking because he couldn't smoke in the hospital. And while I was in the hospital, I put him on a strict plant-based diet. And so he went on a plant-based diet and stopped smoking. We did notice some clinical improvement. Obviously didn't come back to normal, but he did get some clinical improvement with smoking cessation and the plant-based diet. We did start a probiotic and a digestive enzyme as well, addressing some of those problems. So again, those are some of the issues. The Giving Life Nutrition and Wellness asked about effective absorption of coenzyme Q10. Nutrients that are needed for effective absorption, in my opinion, is going to be a natural plant-based diet that's going to improve your microbiome. So the optimal microbiome is going to be the key foundation for adequate absorption for coenzyme Q10 or any nutrient in my opinion. Anybody else have a thought on that?
Well, that's an actually really a good question. CoQ10 is not one of the ones that comes to mind immediately as that it can be affected by other nutrients, but she is right in that, like, for instance, if I want to increase the absorption of iron, especially non-heme iron or plant-based iron, I can consume more vitamin C, and vitamin C will help my body process that better. So there are nutrients that do help other nutrients be absorbed better, but in this particular case, CoQ10, I don't have anything that comes to mind as something that would help with that.
Yeah, and other than improving the gut flora, which is because he had antibiotics, which probably would impair its absorption. And so improving the gut flora would probably help. And like I said, maybe increasing coenzyme Q10 consumption, but malabsorption syndrome in general. That's a great question. Malabsorption syndrome can be caused by a lot of things. A lot of people have inflammation of the gut. And oftentimes when people have GI problems, they go see the doctor, they'll get treated with a proton pump inhibitor, which also depletes coenzyme Q10 and affects absorption of other micronutrients. But the proton pump inhibitors are given out almost like candy. But malabsorption, from my experience, is multifactorial. A lot of people have inflammatory gut, even though they don't have an overt inflammatory bowel syndrome or celiac disease or any of these colitis. I think a lot of people have inflammation in the gut, which probably affects their microvilli. And so they don't have healthy microvilli. And the way the gut works, if you think of it, your lining has like villi where food goes, and I'm trying to show this on the camera, moves up and down. So lots of surface area. And the surface area of the gut, if you take your small intestine, many of you have heard of this, and you just lay it out flat, it's about the surface area of a tennis court. And the way you get all that in there is you get multiple folds and folds on folds and folds on folds on folds on folds. And so with all these folds, you have these what's called microvilli, the kind of microscopic folds. And these are at the point where you have optimal absorption. But if something comes in and chews these things off, instead of having these folds, you got like a nub and it's less surface area. So the food just kind of flies through, as opposed to if the food has to go through that, it gets absorbed because it's going through a larger pathway. If you chew through these microvilli, you got that, then the food just goes through there and it passes through fast and doesn't absorb as fast. So inflammation can cause a chewing away of the microvilli, causing less surface area and causing the food to pass through without being absorbed. That's
you can go a step further. You can go a step further back from that, Dr. Montgomery. You can say the inflammation can also be caused. Well, I've seen several things. One, you can be born with leaky gut. You can. Yep. You can be born with a gut that just doesn't function as well. And so you just have to deal with it when you get older and try to mitigate that. You can also consume foods like gluten. Sometimes for some people it's dairy and other things too, because we see this in autoimmune a lot of times. If you take away some of the things, they start to improve. But it's like those certain foods and processed foods can also cause that whole degradation of the villi where your gut becomes more leaky.
Yep.
There are certain proteins that you can be deficient in that also could cause that. So it's kind of all of those things. And then when it comes to malabsorption, I mean, it's just so, I think you have to kind of look at almost every step of the digestive process, because some people just don't have enough digestive enzymes, or they have low stomach acid. There's
the gut flora. Yeah.
Yeah. There's so many reasons why. Yeah. The gut flora itself, they just have they're overrun with bad bacteria versus good bacteria. There's so many reasons why you can end up not absorbing everything properly.
Yes.
And you said, some people are born with it. A lot of times, though, if I can get mommies to exclusively breastfeed and also change their diet somewhat. So it's important what moms eat. Some people think if they just breastfeed, it's going to correct everything. What they don't realize is it counts what they're eating. And sometimes they do need it to be on a special meal plan. I don't like to use the word diet to kind of feed into the baby to now heal the gut. I try to explain to new mommies that breastfeeding is about quality and not quantity. So a lot of times they'll want to just feed a large volume of milk, not realizing that when babies are first born, the first milk, the colostrum, is there to line the gut and get the gut prepped for food. You're not supposed to be feeding day 1, day 2, day 3. You're prepping. And so this is getting all of those villi in the stomach ready for food to come in for absorption. And so getting mommies and people to understand this is the part of the process that helps us later on in life. Because a lot of people just think, oh, I need to feed, but we're prepping the gut to have a healthy microbiome as we start into life. Because the body is very forgiving. I think a lot of times when people do have malabsorption or leaky gut, if we just pull back a little bit, and a lot of times, and that gets into even fasting. I know we're not talking about that right now, but sometimes if you fast properly, then things will slowly start to heal themselves because we're not putting the toxic chemicals on top of a process that's already damaged.
Yeah, no, that's good. One thing I will say, Celeste, I totally agree. If I am doing a patient interview and I'm going through their health history and I see that they have leaky gut, they usually will have told me at the beginning that they were not breastfed. Because I do ask them if they know if they were breastfed or not. And so it's very interesting to watch that narrative. But if someone wasn't breastfed, you usually see other health issues later on.
And just by way of explanation, we talk about leaky gut a lot, and I want to share with our audience that, a leaky gut typically at the capillary level. So basically you have, when food is broken down, you have very tiny blood vessels that are in like the microvilli and the certain parts of the intestine, because the food goes across the membranes of the intestine and gets into the bloodstream. And so you have these very tiny capillaries. Now, you can have leaky gut, but these capillaries they have small little holes that allow certain small size molecules through. But if they become inflamed, they become more open, and then more larger molecules can come through that shouldn't get through. So like if something's that's larger, that's supposed to go down and be broken down more before it's transmitted across the capillaries. If you have a leaky gut, you can have, it affects it in multiple ways. One of the ways is through capillaries that are too large. And so then these large molecules get across and they can trigger inflammatory responses inside the bloodstream. And so we tend to talk about the leaky gut, and that's really what you're dealing with there, where you have capillaries. And you can get inflammation cause capillary leak even inside the body. And so we get these types of things all the time. And I like your comment about fasting because, I think it's important because, again, although we're talking about nutrition, dementia, but see how it easily gets into some of the most fundamental aspects of how we nourish our bodies. And if we look at how we treat dementia clinically, you put patients on these neurological medications and you expect a certain outcome, but sometimes the core is not so much, directly in the brain, which obviously the brain is affected, but the core starts at somewhere else. And oftentimes that somewhere else is the gut.
I wanted to add something to Dr. Montgomery, because so your patients know, like we're talking about leaky gut, but in allopathic medicine, a lot of times if you go to your general practitioner or internal medicine doctor, they really won't acknowledge leaky gut, unfortunately. So, you may find some resistance if you go in there speaking to them on certain things that have to do with leaky gut, because it's very controversial in the field.
That's true. Yeah, the terminology and terminology is a funny thing because you're right. We in medicine we use labels, and certain labels are accepted and other labels are not accepted, and so it's kind of a funny thing. And you're right. It's we don't recognize leaky gut, but or inflammatory bowel disease. It's really the same type of thing, but they don't like that label. So
But one thing, and somebody is asking this about checking your gut flora. So for a long time, we have not acknowledged how important the microbiome is. But now it's starting to become more mainstream. Over in the UK, I know at least 10 years ago, they were already doing, I forgot the technical name of it, but basically fecal implants, where you take a pill. And when I first heard it, it sounded quite extreme. But they're actually doing it here in the United States now. They do it with the endoscopy or colonoscopy. They implant. So basically, they're taking somebody else's microbiome and putting it in someone else's stomach for Crohn's disease, inflammatory bowel disease, and these things. So this is acknowledging how important the microbiome. So basically, you're taking somebody's stool and implanting it in your body to help your microbiome to become a different microbiome, this other person's microbiome who is healthier.
I've heard of reported cases doing a procedure. They were trying to implant it, and it got this large from the scope and bounced around and hit the fan. So, but to answer that question,
can I answer this question?
Go ahead. Yeah, go ahead.
Yeah, because in my practice, I order a test called the GI Effects Comprehensive Profile from Genova, and I like it because it does break down all of what good bacteria strains you have, any bad bacteria strains you have, certain important enzymes like beta-glucuronidase, which I look at a lot because I have a lot of clients with fibroids. And if you have high levels of beta-glucuronidase, you're going to be recycling estrogen. So it's a really cool profile. It also will tell you if someone is more on the, like, has dysbiosis, or like more like maybe you should consider testing for SIBO or any of these things. I like the GI effects test. I think it's a really great test, and it can tell you a lot of information about the state of your digestion in your gut.
Yeah, that's great. Yeah, that's an excellent test, and we use that in our clinic as well. The stool test, and then and of course, some people have trouble, sending stool tests, but we also the Genova Nutrival indirectly gives you a look at the microbiome, and it's if it's way off, you'll see that, and like if you have malabsorption components, then that's a quick and dirty way of doing it. And if you don't get enough information there, then you can then say, okay, let's get a stool test. So the answer is that there are ways of doing it that are excellent. Now, can juice fasting or juice feasting improve your gut flora? We observe a lot of people juice feasting. I honestly can't say that I know the answer to this question. My suspicion is that it does, but I don't know that it does because I haven't done any testing. When we've done our juice feasting, we look at biomarkers. We don't look at gut flora before and after. That's something that we will probably do in the future and get some idea of that. I suspect it does. I think you have to go a very long time, though.
No, I don't.
Oh, go ahead.
Go ahead.
No, go ahead.
I saw a study a few years back before probiotics became as popular as they are currently, and the question was, is it better to feed your microbiome that you have, or is it better to take a probiotic, which is going to give you a whole host of new lactobacillus for your microbiome. So in the study, they show that even though people are taking the probiotics and, it has 1 billion of the units in it, most of those are not absorbed, and most of them are don't survive the process. And that's why there's so many of them in there. And then also probiotics are questionable because some of them are in the freezer, some of them are freeze dried. So you kind of don't know what you're getting unless you know the company, where they're coming from, what's the process that they use to get them onto the shelf. So it becomes a little bit questionable with probiotics, although, they have helped a lot of people, but I think that's because we have gotten to a level of being so deficient that, anything will help at this stage. But the study basically showed that if we can get our own microbiome back up and functioning, it works much better than the probiotics do.
Let me ask you, in that study, do you recall what they were doing? These people stopped their medications? Did they stop? Because I guess
I don't remember the specific. It was several years ago.
One thing I was going to say is I was listening to this really amazing podcast with this guy, Dr. Gilliam, I think his name is, and he wrote this book called Supplementary Dietary Nutrients. I actually have it in my office. I don't have it right here, but he's a really knowledgeable guy. And he was just talking about how probiotics are kind of, if they can be iffy, but lactobacilli, bifidobacteria are usually beneficial for most people. And I don't think that, in my opinion, I would have to do some more research on it, but I really don't think that the juicing in particular is going to help with your gut flora. I do think that eating more fiber will, because eating more fiber could increase the production of short chain fatty acids. I think that I like to tell my clients, especially if I give them a probiotic and they feel like it's not doing anything, or they feel like it makes them a little queasy or something's weird, I usually start with food. So I start with fermented foods. Like, do you like sauerkraut? Do you like kimchi? Do you like any of these other things? Because I feel like that process actually seems to be better. Like most people's bodies can handle that better. If they have a little bit of sauerkraut on the side of their dinner, it's going to be, you know what I mean, better absorbed. It's going to be more organic as far as like what's in it. You know what I'm saying?
Yeah.
So yeah, I kind of agree. Like the probiotic thing is a little tricky, and they were even talking about like spore probiotics versus regular probiotics, and how it doesn't really. There's not enough research necessarily yet, or enough experiential. There's just not enough for us to definitively say this is working.
I don't think there's enough data in probiotics, period, for us to say anything or anything. I mean, the only reason I say the juice feasting could work is that we have a large experience with it, and we have a large experience with juice feasting helping overall health. Now, granted, we don't measure probiotics before and after, but I cannot imagine something being so powerful in people with things ranging from inflammatory bowel disease, heart failure, diabetes. I mean, everything and it's not like one or two patients. We have thousands of patients over 15 years, and juice feasting across the board is the most powerful. So while I can't say definitively that it does help with the gut flora, I have a hard time thinking that it hurts, because the patient is getting so much better. And if somebody's getting better, I can't see somebody with heart failure, inflammatory bowel disease, all these other conditions that we treated getting better without their gut flora getting healthier. I just think we need more data, because I get pushback on juice feasting from my colleagues, from I'm not going to name names, but they say that, and everybody has a theoretical pretense for it. Well, it shouldn't work because there's this, that, and the other. But when you look at patients getting healthier, it's a very powerful tool. And even somebody asked about fasting. I think they meant water fasting. You might even argue, can water fasting help with gut flora? That's a question we may bring with those guys. I don't know the answer, because I haven't done the measurement.
I think it would have, at first, I think, we know that juicing is really powerful for detoxification and healing, et cetera, right? When it comes to just fat, so if I just took someone who had like candida, let's talk about like someone who has like overgrowth, and said, fast and you'll get better.
Yeah.
That's not going to work, because when you get to the place where someone is in a place where there is bacteria or overgrowth that's really not beneficial, I really do believe in Dr. Jeffrey Bland, the CNS, who's considered the father of functional medicine, where he says you need to remove the thing that's offending it, re-inoculate, replace, do that whole process where you kind of like, okay, I'm going to give them things that are going to get rid of this candida. And then I'm also going to be changing the diet, obviously. And then I'm also going to maybe increase some beneficial bacteria, maybe for eating fermented foods, et cetera. Once I've gotten rid of the initial problem, you see what I'm saying? But just to have them fast,
But here's the thing, Sosa. I'm a scientist, so I want you to show me the science. Show me where you've done this compared to that. Because unless we can show the science, we can't. Because I've been in situations before in medicine and outside of medicine where people say, well, this shouldn't work. but then when we actually do it, it does work. And so I think we really need to look at the science, because we see patients who shouldn't, do well on a juice feast. And I've given emaciated cancer patients on a juice feast, and they shouldn't do well, and they do well. And so we need to look at the mechanisms, and we need to, the point I'm saying is that show me the data, and then I will believe it. And I think we have to, from a science, I don't want us to say, well, it shouldn't work. I don't think it'll work. I want us to look at the data. And if these guys have the data showing that a juice feast failed and this other thing worked, then okay, I'll accept that. But unless I've seen the data, I don't want to just sort of throw something off and say, well, it wouldn't work because it shouldn't work, because, you see what I'm saying? Because we do that a lot in the plant-based community. I see a lot of my colleagues who are physicians and scientists. So, well, you shouldn't do that because, it shouldn't work.
I'm not a part of the plant-based community per se. So,
well, I'm not saying you are, but I'm just saying. what I'm saying is that I want us to show me the data that it doesn't work, or show me the mechanism as to how it doesn't work.
Now, I have something to add. That I don't have the data right here. Some of the studies that I've seen, the most healthy gut floras and the floras that they're getting these fecal samples from are from different places on the continent of Africa. And, so just based on what we know of how people are living on the continent, they're not taking probiotics.
Yep.
They're not juicing. They're eating from the earth. Yep. And they're walking outside, grounding every day, and they're having community contact,
Yep.
So they're living a life. And so if you just take that, knowing that as a fact, then we know that they've done studies on their stool, and they have the most diverse colonies in their stool. So if we can mimic that type of lifestyle to an extent here, then we know we should be able to extrapolate that we could improve our gut flora also.
I'm glad you mentioned that. That gets into, it gets into, and I know you want to jump in, so I'm gonna let you in, but it gets into why do we have an abnormal microbiome anyway? It's not only what we're eating or not eating, but we're washing our hands. We're indoors most of the time not our nature. You put it out there, not only eating from the earth, but they're in nature, etc. I just recently started working out in my backyard all the time, getting muddy and dirty with my trainer, because I'm indoors all the time. And so being outside, I think that's a key part of it. And I don't want to say like things like juice feasting is a end all be all, because I think the point you made is that there's a more global thing. And I think so you make the same point. It's a more global thing in terms of removing the offending agent, and removing the offending agent is to get out of the unnatural environment and get into the natural environment. But yeah, I agree with that. And I think that's, if our audience take away something or take away anything from this, I think they need to take that away in terms of microbiome. Even though we started with dementia, we're going to get back to dementia in a minute, but they need to take that away. So you were going to say something.
Yeah, because Celeste's point brought up something really important, which is, okay, because I'm African and I have lived in Africa, in various parts of Africa for extended periods. And we eat a lot of like gut-friendly fiber. We eat a lot of those prebiotic foods. We eat a lot like plantain and tubers and all of these things that really are kind of like fueling their food for the gut. And so I just thought I'd bring that up, because you're right. It's not like we're out here juicing.
Yeah.
You're not just like, you know what I mean? They're out there eating their plantains and their tubers and all of their, the natural fruits and the whatever is there, the herbs, all that stuff. But there's a lot of fiber. And so I think that's one key thing to pull away from the diet, and why it also might be supporting the gut, in addition to the fact that obviously there is a lot of exposure to the outdoors and to a whole range of different pathogens and different things. So it's not like these are weak systems.
Yeah.
Either.
And a lot of the foods we get in the produce store has been gassed and it's been processed in a certain way. So even we're getting the produce, and we may need to bring a grocery person on one day and talk about that process. But a lot of the foods have been, gassed and steamed. Like, you look at the bananas in the stores and it's a little green on the stem, but then it got black spots all over. That means they try to gas it to rapidly get it to ripen rapidly. So we do a lot of funny things to our produce here, as opposed to, as y'all were alluding to, in areas where you're getting the produce from the earth and consuming it more closely, I think is probably a critical factor as well.
No, it is. The pesticides. The other thing is pesticides here cause damage to our microbiome.
Yep.
That's a huge thing. And clients that I've had who come from Africa or they come from somewhere else, sometimes have a really hard time adjusting to food here. I know that my parents had a hard time, and I had to explain to them that this is not the same food. And then my mother just went on this gardening thing for many years. But it's just, it's not the same. It's not the same. We don't spray our foods like that in Africa.
And it doesn't even taste the same. I mean,
no.
It's a whole different experience to eat outside of the country than it is to eat here. And actually, for some of because I have patients from all over the world, it's actually outside of the United States, everybody knows that our food is overly processed and not really good for us, except for us.
Right.
Yeah.
Right.
We just know we're getting sick all the time. This is very interesting because, we started talking about dementia, and if somebody came in and saw the title and then come in and in this conversation now, so what are you talking about? What about dementia? It's really a global issue. Now, I want to talk about another patient I alluded to is my mother, and she died 2002, and she had a meningioma, but she was having a brain syndrome. In other words, she was presenting with rapid dementia. Now, she had a meningioma with some swelling that was treated successfully, but then she had this precipitous progression of dementia, and she eventually died, but she died from liver failure. And I've told that story before in different talks. And what happened was that she was on 5 different medications throughout the life. She was a diabetic, had high cholesterol. She had coronary disease, ended up having a stent. But she was on 5 different medications that were cleared through the liver. And so she was getting progressive liver dysfunction over time. The reason I'm bringing her up, I have a lot of other patients who've had similar issues, is that people develop progressive liver dysfunction, which has an adverse effect on the brain. And so oftentimes it's due to polypharmacy, lots of medications. I've had patients, one particular patient I've had who had delirium and was attacking his wife at night, et cetera, because of a medication he was taking. Now that's sort of like an acute delirium or acute, but dementia can present the same way, where you have these acute outbursts where you become angry and enraged, and then it progresses over time. In this case, we pinpointed to a particular medication. So we have a lot of people who are on medication affecting the liver directly, which affects the brain directly and indirectly. And so you have dementia that's developing in this regard. Not to mention, poor diet causing vascular disease contributes to vascular dementia. So if you have someone who's on a poor diet and then they're taking lots of medications, they're on hydrochlorothiazide for high blood pressure, other medications, these things are affecting the liver. And so the blood is not as clean, so you get brain fog from that. You're eating the standard American diet from food with pesticides, which is destroying your microbiome, which then is causing atherosclerosis and cerebral vascular disease. Then you're taking medications to treat the side effects there. The medication having an adverse effect on the liver, again affecting the brain, again affecting the gut flora, affecting malabsorption, and then the medications can have other effects, that's directly on the brain, even without affecting the liver. So what I want to do is I'm trying to bring our discussion full circle for our audience to say, okay, yeah, we're talking about dementia, but what I want the audience to take away from this is that dementia, even though we have a certain diagnosis, a definition for it in the medical literature, vascular dementia, blood vessels in the brain, you talk about a stroke, which is a heart attack, a brain attack, or a heart attack in the brain. You have Alzheimer's disease, which is kind of a basket term for with dementia. We're not sure what the cause is, but you can have all of these types of toxins. All of this stuff originates from what we're putting in our system. So dementia, in my opinion, my professional opinion, is more of a systemic disorder, not so much a disorder isolated to the brain. I know we're coming up on 8 o'clock. We're up on 8 o'clock.
Can I say something before we?
Yeah, I do want you to say so. I want you to talk about kids and ADHD, but go ahead and say what you were going to say before.
So I think so Shonda H, Real Food and Drinks over here, she says, but their earth is full of more nutrients. We need juice to get our nutrients. Go up one.
Oh, my bad.
That one.
Yeah.
And she says she's traveled and not had any digestive issues when she traveled out of the country. So I know what she means by that, but the problem with that is if we accept that, then you have to understand that the juice that we're drinking doesn't have nutrients either. So if you're saying that our earth is lacking nutrients, and our food is lacking nutrients, and our juice is lacking nutrients also, which is a major problem. And so that's why like Eosa said, her mother decided to grow things in her backyard. I know Dr. Montgomery has things growing in his backyard.
Yeah.
Working on I have gardens that I go to too. So we have to take control of our food source ourselves, because when you are getting things from a grocery store, you don't know what they've done as far as the processing, as far as the spraying, and is the earth delinquent or deficient, because they're growing the same crop every year and not rotating.
Yeah.
You gonna say something, Sosa?
Well, you were talking about not knowing about Alzheimer's, but I feel like, people are calling Alzheimer's type 3 diabetes because it's connected to insulin resistance.
Mm-hmm.
And so I remember doing a talk about this where we kind of just went over like preventative measures well before you even get to the ages, you know what I mean, where it could be a problem. And obviously good sleep, healthy diet, etc. But also like managing your sugar intake is important. And it's also important for brain function overall, as we know. We know that when you're sleep deprived, Celeste did that thing on sleep, but when you're sleep deprived, your brain is naturally going to want some more glucose, etc. If you're chronically sleep deprived for a really long time, that can also lead to decline in brain functioning. But I just wanted to bring up the sugar thing because, especially with Alzheimer's, because they've even done studies now where they've shown some improvement with Alzheimer's patients on ketogenic diets, and that's because the brain is not able to run as well on glucose. But then when you put them on the ketogenic diet, there's a improvement in brain functioning and ability.
Yeah, and I think what I meant about the Alzheimer's, when they give Alzheimer's disease, it's not a clear-cut etiology, and so it's a basket term. So it's like essential hypertension. Essential hypertension is not a defined cause of high blood pressure. I have some people essential hypertension is adrenal problems, some people it's vascular problems, and some people it's a combination. And Alzheimer's is probably a combination of things. They have some microvascular disease, and there's some metabolic things, like you mentioned with sugar or various other things. And so I think it's a combination of things and Alzheimer's is almost a basket term, because somebody says, they have Alzheimer's. They would not have gotten an MRI. They would not have gotten, any detailed study. So that's sort of where we're talking about there.
The other thing is Celeste mentioned fasting earlier. And fasting.
Ask the question.
With Alzheimer's, Parkinson's, the process of autophagy, that cell cleanup, stops working right. And when we fast, we actually encourage autophagy. Like we encourage the proper, regular cleanup. So that was another thing that you could do preventatively, even if it's just intermittent fasting or just taking short breaks or juice feasting or whatever. Those are preventative things that you can do prior to the onset. Yeah.
And if we're getting a good night's sleep, we're fasting on a regular basis. And I think Shonda H gave us a little bit of a kickback on our response to the juicing. See, my juicy club here. Hold it up for me. I think the point she's making is that you can consume more nutrients from 20 carrots if you juice it. I think there are benefits of juicing. I think we need to do more studies with it. I don't want to argue one way or the other. I'll tell you what I'm going to do. I'm going to invite John Rose on the show one evening. So I'm going to bring John Rose on, and he's going to talk about juicing. He was my mentor in this whole plant-based and nutrient thing almost 20 years ago. And I'm going to have him talk about juicing. So we'll make note of that.
Shonda was saying that in response to me, what I said, but I don't want Shonda to think that I'm discouraged juicing, because I am an advocate for juice.
Yeah.
I juice. So I tell my patients to juice all the time. I'm an advocate for us trying to grow things ourselves, and then we share different things amongst ourselves. So that way we have at least 1 or 2 crops that we know the source of.
Yes. Can you give us a few bullet points on ADHD, Celeste? Because I want to try to, even though we're talking about dementia, these chronic illnesses, and I'm just going to say this little bullet point. When I was in medical school and all, type 2 diabetes was strictly an adult disease. Mm-hmm. And now you got 8-year-olds. And I think I've seen someone as young as 7 with type 2 diabetes, and probably even younger than that. You may have seen younger than that, but I remember seeing someone 7 years old with type 2 diabetes. So the point is that if type 2 diabetes can encroach upon pediatrics, can dementia encroach upon pediatrics? And this ADHD, is this some kind of a pediatric version of a dementia-like syndrome? What say you?
The studies don't say that.
Mm-hmm.
But so the definition of dementia that we've talked about is rare in children based on the definition that we're using of dementia. But there are some children who have suffered with certain things, especially if their thyroid is not functioning properly, if they have lead poisoning and certain other chronic illnesses, but those are kind of more rare. Now, what I was referring to when we were kind of talking backstage is that the children are very forgetful. So let's just use it as that term instead of calling it dementia, because I don't want people to say that Dr. Palmer said that dementia is ADHD. That's not what I'm saying.
And I think that's an important thing, because everybody gets bent on labels, and so I can appreciate your being careful there.
Okay, so the children are very forgetful, and to the point where some of the children are attention hyperactivity deficit disorder, and some of the children just have difficulty remembering certain tasks that they're asked to do, especially in the classroom. But in that scenario, it seems that a lot of them get a diagnosis of ADHD, and they are started on the stimulant medications. The parents will immediately see a response, and so everybody feels like it's working because they get a response. But stimulants will probably work on anybody. It's going to make anybody focus. So you're going to see. I've not tested it, but I think you're going to see a difference. And anybody who takes it is going to feel a difference, because the children will say, "Oh, they definitely can feel a difference. They can feel when their medicines are weaning off, and then they become more. Their brain becomes more creative." Is actually what they say. It becomes more. We say scattered, but they feel it's more creative. And so when we use those medicines, it kind of focuses and pulls everything into one space. So the question of, why are our children not being able to remember simple tasks? If a parent asks them to go upstairs, bring me a book, a pen, and a piece of paper, they may remember the book, but they may not remember the other parts. And in most cases, they kind of just say, "Oh, I just don't remember." They don't really try to remember. And that goes back to what we're putting in our bodies, as we've talked about this hour. Children are taking in a lot of processed foods. They're taking in a lot of sugar. They're not spending as much time outside as we did years ago. They're not interacting with nature like we did years ago, because a lot of them are inside on the tablets or on the cell phones, sitting in their room. And it's just kind of I'm seeing the effect of having an imbalance with nature. I know that might sound a kind of eclectic, but imbalance. And what it's doing is it's taking away from their ability to kind of string tasks together and remember everything that was said or what was told.
And the thing is, I know, and we're not going to say you're calling dementia and ADD the same thing, but we're talking about brain function. So kids, brain dysfunction or cognitive dysfunction, we often refer to as ADHD, and in adults we refer to as brain fog or dementia or whatever the case is. And I think when we do these labels, and even though I label this talk dementia, I mean, we rapidly got away from the formal definition of dementia, and we got into a lot of these different things, which has a common denominator to what you're talking about: proper nourishment, the proper biochemical balances, and the things that we need to keep our bodies biochemically balanced, i.e. fresh air, sunshine, getting in the soil, and keep your ecosystem. Your body is an ecosystem. And so you keep your local ecosystem in balance, things get in balance. C. Colette is saying, I've always wondered if the two were connected. My ADD has definitely gotten worse as an adult. Laugh out loud. So, we do have adults who complain of, ADHD or ADD. And so, again, that's kind of an overlap there. So, we have different labels, and I'm not saying dementia and ADD are the same thing. I know people get out there and say, oh, yeah, Dr. Palmer said this and Montgomery said that. But I want us to think about, and when I treat patients in my clinic, I don't treat disease labels. I treat biochemical imbalances. I treat pathophysiological conditions. That's what I treat. So I say, well, this person has a label of heart failure, but physiologically what's going on, because it's more than everybody walking in with a label of heart failure do not have the same physiology and biochemistry that's going on. And so I need to look at the overall physiology and biochemistry when we do our testing and that type of thing. And I think that's what this discussion has led us to talk about, not just the label of dementia, but rather, okay, you have dementia, how do you get there? And when I was presenting the case of my dad, associated me, said, well, how long was he on the hydrochlorothiazide? So we immediately got into the biochemistry and physiology of things, which I think is right point on. So anyway, Shonda H says, preach it, Celeste. Wish you were my pediatrician when my kids were small. Well, look, guys, I really appreciate this. I mean, we can go on for another hour. We may have to increase the length of the show. I don't think our sponsor will do that. So I'm going to go ahead and close this out. Thank you for the discussion. I'm going to see you behind stage afterwards. Well, everybody, again, thank you very much. This has been a very enlightening discussion. And so as my colleagues and I have discussed, dementia, even though we think of it as a brain disorder, I want you to understand that, we broke this down to more of a systemic process that leads to brain dysfunction. And we talked about a healthy gut. We talked about a healthy diet. We talked about a healthy environment in terms of getting next to your earth, et cetera. We talked about potential adverse effects of medications and a whole slew of things. What I want you to take home is that even though we're talking about dementia today, next week we may talk about some other condition, et cetera, the body works as a whole. And in our many discussions, we're going to come back to this whole basic fundamental concept of keep the body properly balanced biochemically, physiologically, and in other manners. So keep that in mind as you think about not only dementia, but other health issues. So I'm very glad you joined us tonight. I'm sorry we went over just a little bit, but we had some important topics we had to discuss. So next week, we're going to be talking to Dr. Saray Stancic, who created the documentary Code Blue. And she's going to be talking to us about MS, among other things. So join us next Monday at 7. Until then, keep it fresh, natural, and live. Thank you.